My name's Ellie McDonald. I work at WriteUpp. We are a practice management software company. And today we're going to be looking at what practice management software is and how it can help you and your clients as well. But first of all, before we go anywhere, before we start, let's have a think about what practice management software, what practice management actually means. Essentially, practice management is the term used for the admin and business side of a healthcare or medical practice. The responsibilities include client record management, so you might be doing that, appointment and diary management, reminding people about appointments, invoicing, ensuring you comply with data legislation like GDPR, a really, really important one. So you're probably doing that in your practice at the moment, or you have an administrator doing it for you. And all of this admin, it often distracts from the actual service being delivered to you and your clients. Now, the beauty of practice management software is that it does the hard work for you. So it helps you to put everything involved with running a private practice into one secure and automated place. And basically, it's there to save you time and worry. So really, really can help just for you personally, but also for everybody else in your practice. So while a small practice might be able to get by using paper-based and manual systems for a while, many practice owners do find that they work in a much more efficient and professional way once they move to an online practice management software. The other bonus is you'll be able to run your clinic from anywhere as long as you've got the internet connection. So on your phone, on your tablet, on your computer, wherever you are, you're able to access and run your clinic, which is really, really essential over the last couple of years when you perhaps haven't been able to get into the practice itself physically and you've been working from home. So really, really, really beneficial in that way. Your information is actually stored in the cloud, so nothing's stored on your computer. So assuming that you've got that desktop, laptop, tablet, smartphone, you can run your clinic with ease from anywhere. So it's not actually stored, on your hard drive. Cloud-based practice management software, and I will be going through what this means later on, cloud-based software is extremely secure, and it is now the preferred software model of pretty much all major software vendors, including Microsoft 365. So the next question really would be, what does practice management software actually include? So a really basic practice management software typically includes an appointment diary, a client database, somewhere to store your clinical notes, patient correspondence, and also some financial reporting. But you want to look for something a little bit better than that. You want to look for something that the better, a few more features that would be involved in that. So let me just get this up on the screen and you can have a look. So in here, I'll just go through these. You can see them on the screen as I'm talking about them. So what should a good practice management software include? So what you want to really look for is what the good guys are doing, the big guys are doing. If you're going to be paying for this service, you really want to be able to use it and use it to its maximum ability. The more cutting edge companies will also offer online forms and assessments. So a way that your clients can fill in their forms online and then they're saved to their record for them. And it just means that you can get all of the forms and all of the paperwork done before they even attend in clinic. An online consent portal as well, that's really important, so that you can get consent for things like GDPR and any terms and conditions that you might want to get signed off before they come in. You can get that done online, again, saved to their record automatically for you, so that you're not having to send out bits of paper, ask people to sign it, and then it's coming back. You might want to have a cashless payment functionality, which includes in person. So if they're coming in clinic, you might want to get like a terminal, like a payment terminal, like Square, for example, that people can just pay with their card or their smartphone instead of using cash. And it also means that they're able to pay for their invoices online as well. So you could put a little box on your invoice that says pay now. They can pay that online. They don't need to be transferring money in their banks and things like that. It just makes the whole process a lot easier. Also, you're going to be cutting down on how much cash you're handling. Online booking as well, so your clients can book into your diary online. It just means that you're not having to actually arrange anything with them. They can just literally go online, pick a date and a slot in your diary and book themselves in, and that's all done automatically for you. They're sent all their info automatically. They're sent their forms then automatically that they fill online, and it's popped into your diary, and then you're notified of that booking. Again, it takes out a lot of admin time for you. A video consultation feature. This is something that's grown massively in the last 2 years. You can conduct video calls with your clients. It depends obviously what professional speciality you're working in. Easier for, say, psychotherapists and counsellors to use than perhaps physiotherapists, but still a really important feature that a lot of people are using and utilising now. And you can get those built into your practice management software, so you don't have to be having all these different accounts. You can just use it in your straight into your practice management software. Automatic email and SMS communications, especially reminders. What this means is you can actually automate the text messages that are sent out to your clients, say a day before, just to remind them of their appointment. Really, really great for cutting out your no-shows. You can have things like a client waiting list, tasks lists that will remind you of things that you need to do and also things you need to do for your clients. You can have templates, documents, and notes, and also medical practice and clinician and analytics, which will really help you to grow your practice. Okay, so that's what the software does do. What about stuff the software doesn't do? Well, basically what it doesn't do is the real job, seeing patients and helping them. That's what you're there for. And why not let technology do that admin for you so that you can get on with your job? The tech's there, all you need to do is embrace it. You don't need to be particularly techie either to use it. Most systems are really, really user-friendly and intuitive, and you can kind of click your way through, and it's not too difficult. So let's take a look at the few key benefits to you as a clinician then. You'll spend a lot less time on admin, and I mean a hell of a lot less time on admin. You'll spend much less time looking for information, preparing notes, writing client emails and text messages, so much more. There is a ton of admin that practice management software can take off your plate for you. You can send out forms to be completed online in advance of the appointment. Some of the more advanced practice management systems will automatically import the client's data from this form straight into their contact record. So if you're sending out, say, an intake form and you want to get all of their information, or, you know, address, next of kin details, date of birth, all of that info, you can put it on a form and then you can import it straight into their record for you. You don't have to get a paper form in from your client and start typing this into an Excel spreadsheet, which you may be doing at the moment. No, it will just do that automatically for you, and then you can access that from anywhere. Your clients can book appointments themselves, as I mentioned, on online bookings. That's going to save you a load of time. It cuts out telephone calls, emails, all that stuff. They can just literally log in from anywhere at any time and book an appointment with you. And their information is all automatically added to their client record. Your diary is automatically updated with the details of the appointment. So loads of admin time cut down. And that's just a few basic functions being used. The second one, then, you can reduce your no-shows to almost nothing, which I kind of touched on earlier. You can use automated appointment reminders, and they're really effective as the system sends them out for you, so you're never going to forget. So when you book an appointment in for somebody, the system will know when it's 24 hours before their appointment, and you can usually set these up for different times as well, so it doesn't just have to be 24 hours, and they'll just ping them a text or an email or both to remind them of that appointment. So it just means that any no-shows is really going to significantly cut down, because a lot of people are checking their phones every minute of the day, so they're going to see that come through. You can also set up integrations with payment systems like Square, so that you can your clients can pay for their appointment before it's even confirmed in your diary, which is fantastic. Obviously, if they are paying ahead of time, if they're paying before their appointment starts, then that's going to cut out no-shows as well. People will usually turn up if they've paid. You'll also have the time and the tools to grow your practice. This is a pretty big one, because your software streamlines your admin for you. It creates more time for you to spend with your clients, and that's if you want to do that. It frees up hours which you can use to invest in activities to grow your practice, like marketing, so that you can take on new clients, you can generate more income. You can also run reports which will help you to understand what's happening in your practice, so that you can start making improvements in areas you didn't even know that you needed to. It really, really does enlighten you to a lot more of the things that are happening in your practice. You can simplify your compliance with key regulations like GDPR. Yeah, this is a really big one. GDPR is a major source of anxiety for a lot of practitioners, and it's what a lot of our users talk to us about. Luckily, most major practice management systems do have ways of simplifying the process. So if you do want to invest in a practice management system, it's definitely worth checking this out and making sure that it has got the tools that will help you. They'll make it easier. You can capture privacy consent, for example, which is Article 13 of GDPR, fulfilling access requests, which is Article 15. So it's pretty neat, actually. It'll help you. And the final one is you can start saving the planet. Look, this is really important. And going paperless is a really good way to make your practice more eco-friendly. And it's something you can boast about. If you do actually decide to take your practice online, you're a more eco-friendly practice. In general, healthcare facilities use approximately £2 billion of paper each year. And that's a massive amount of paper, adding to the already overflowing landfills around the globe. So going paperless is not just great for you, it's not just great for your clients, it's great for all of us as well. And you know, every little bit helps, right? And this is 5 reasons why your clients will love it. And I promise you I will take away these slides soon, because I know it's painful looking at slides. But for the first one, you can improve your client's experience and interaction with your practice. When it's easy to communicate with your clients, you'll do more of it. You know, you might not have the time to do it at the moment, but if you do use a practice management system, you will have time to do more. Your clients and partners, they'll love the professionalism and the care that this shows. So, you know, it will really make a difference to them. It'll just put you above, it'll put you ahead of the rest, basically. Their data will be secure. So your data won't be stored on a PC or laptop. It also won't be stored on paper in a filing cabinet somewhere. If either of these were stolen, your data, you know, your data's gone. All of your patient information is protected on a secure server, which complies with GDPR, and that's really important. And it really matters to your clients as well. They don't always need to speak to you. Now, this sounds strange, I know, but people tend to prefer nowadays booking online rather than picking up the phone. Unfortunately, that is a fact. One of the biggest drawbacks of phone-based booking is that whilst they're a more personal experience, they're reliant on 2 people to make the booking work. And they also rely on your client wanting to actually phone somebody instead of just going online and booking it themselves. It presents an issue for your client. You have to bend their schedule around your hours. On your end, the hours you can take bookings between are limited because you're in practice, you're actually treating patients. So the number of calls that you can take at any given time, perhaps, you know, they're quite minimal, especially if you don't have an administrator. You could just be on your own, which a lot of our users are. They're just one person running their practice. You don't have time to be taking calls all the time to book people in. So using online booking means clients, they can book anytime on any platform from anywhere in the world. And you can, and they're in your diary. You haven't had to do anything. Kind of similar to that one, they can also pay online as well. Cashless payments are huge and important in the world we live in post-COVID, and we know this from the last 2 years. Bank transfers, they're also slow, they're clunky, and they're time-consuming for clients, and they put it off. They look at that and they think, I'll do it later. I just don't have time, and I really can't be bothered with that right now. So the best practice management software will integrate with platforms like Stripe or Square. There's loads of them, and it just means that you can take payments online at the click of a button, either before or after your appointment. And you can also take card payments in clinic, as I said before. So even if you are a one clinician practice, they can still pay by card on a little machine, a little beep machine, which you've probably seen out in the wild. And finally, the last reason that your clients are going to love this is because they'll get more time with you during appointments, because they filled in your intake and consent forms online before their appointment. They've done all the paperwork, it's out the way. You don't need to spend any time doing this with them in clinic. They don't need to sit in a waiting room with a clipboard and fill in forms. It's all done. Your clients will see this as a huge benefit. They are getting more appointment time for their money and getting the help they need more efficiently. And you know, what's not to love about that? Okay, so I'm going to go into WriteUpp now. I just want to show you, I'm not going to go through WriteUpp or anything. That's another webinar for another time if you do fancy looking at that. But what I'm going to have a look now at showing you is some tools just to simplify your GDPR compliance. And this is kind of one of the really important things that we know our users worry about. So I'm going to jump into WriteUpp. I hope you can see that. This is just my WriteUpp screen here. This is my diary. It's obviously, it's not real. These are not real patients. In fact, it's all one patient. So if I head into my tools section, these are just some of the the tools that we offer people to help with their GDPR compliance, and it really just takes the strain away and the worry away, and it'll help you have a better night's sleep. Basically, there's a few tools in here. For example, we've got a data hygiene tool. This is a fantastic tool. If you but you will legally have to delete all of your patients' information, all of their records after a certain amount of time, say 10 years, you have to, by law, delete all of these. You can go in here, time since last intervention. If I go to 10 years, that will find any patient record that I haven't done anything with in 10 years. So I've closed them, I've discharged these patients, I've kept hold of their records in WriteUpp, but now I need to delete them. You can then go through and delete all of those records. So you don't need to start thinking, you know, once a year, once every 6 months, oh my goodness me, I need to have a look and see who I've had on record for 10 years who I haven't seen yet, and I need to go through. You don't need to do that anymore. Save time, save stress. Use practice management software and it will do that for you, and you can just go through and delete those. If I go back into my tools, then there's things like a security log. Most practice management software will have this. You can see who's logged in, you can see who's deleted a client and who's done it. You can see who's exported data, who's been logging into the account. It just keeps it really safe. So that's a pretty good one. The access request is our main GDPR tool that we help people with. So a client obviously is legally allowed to ask for a copy of everything that you hold on them, all the information that you hold on them. Instead of trying to find this in your paper files and then scanning these in and emailing them to them, or making a copy and sending them to them. If you use this software, you can literally go create a new access request. You can download your client's file into a zip file. It's secure and it's safe to do so. And then you can email it to them. And it takes minutes instead of potentially hours and a lot of stress. So really, really good tool to be checking out. If you are going to be looking at practice management software, do make sure that there is an access request tool in there, because that's a really big time saver. You may never need to use it, but if you do, it will really, really save you. You can also obviously export all of your data out of a practice management software. You don't have to keep it in there indefinitely. You can take it out at any point. You can then save that to your computer and just make sure it's secure, make sure your clients know that where their data is being held. And you can obviously delete clients as well. So if somebody's asked under GDPR to be completely forgotten, you can do that as well. In practice management, most practice management software will allow you to do this, and it can't be undone because, for example, with WriteUpp, we don't control your data. Your data is yours. It's not ours to keep. So if you delete it, it's deleted. It is not kept on any kind of backups. It's gone. So you are in control of that data. Okay, so I'm going back in here. Where are we going next? Right, so let's have a look. Do you really need a practice management solution? So this might all sound a bit whizzy and a bit much, and you might think, I really don't need all this stuff. I really don't need to do all these things. Think again. Statistics from a recent study conducted by softwareadvice.com, they do point to a growing need for this software. According to their research, the most common needs that practices had when starting with or switching to a new practice management system were these ones. So they wanted a better organized practice. They wanted integrated and automated assessments and forms, really big one that a lot of practice managers are looking for. They want a reduction in time spent on admin. Who wants to be spending all their time on admin? I don't think anyone does. Integrated scheduling and also billing as well. And this is just some of the key findings from that report that I thought were really, really interesting. So you can see here on the right hand side the top reason for the top reasons for buying the new software. These are, people setting up a new practice was the biggest one, and you can have a look down through there. I'll send these slides out in the email, the follow-up email after you've attended, so you can have a look at them in more detail. Also, if I go down to the bottom left, the prospective buyers by size of practice, really interesting one. Solo practitioners are the ones who seem to benefit and are more interested than most others in a practice management software. And This is because they don't necessarily have administrators working for them. They need something that will basically do the admin for them. They'll do all that stuff so they can just get on and do the job that they're there to do instead of all the other background noise. So solo practitioners really do benefit the most from this software. And in the top left there, you can see the deployment preferences now. People aren't really, I mean, overwhelmingly not interested in having a software that is on premises, that is downloaded onto their hard drive. Cloud-based software is really preferred. And that's a lot because people want to access it from anywhere. So they really want to be able to be in the car on a way to an appointment, for example, and be able to look up their client's notes from their tablet or their phone, wherever they are. And as I said earlier, if you can't get into the actual physical practice, if you're working in one, you want to be able to manage that from home. I want to just quickly go through what cloud-based software is, because I know it can be confusing and it can be a bit like, what on earth does that even mean? It's in a cloud, it means nothing. And before I really dug into it, I myself, before I worked at WriteUpp, I didn't really know either. So why cloud-based software? What is it? The best way to think of cloud-based software is like a utility or a service. So there's no software to install, as I said, there's nothing to download. Everything is stored in our secure data centers, which are operated by Microsoft. They are super secure. You simply open up your web browser, you log into your site, you do what you need to do. And then the bottom line is that you have access via any device with a mobile connection and total peace of mind that your data is secure, backed up and always available for you. So you don't need to worry about that. You don't need to worry about how safe your data is. It's safe, it's done. Your filing cabinet is a thing of the past. You don't need to be worrying about that anymore. So that's just a few reasons why you could choose cloud-based software. And as I said before, these slides will be available for you afterwards. So you'll be able to have a look through and just have a look in there. And there's tons of information on the internet as well about cloud-based software. So do look into that if you do have time, if you are going to think about investing in it. And the final part of the webinar today is really which software should you actually go with? There's so many out there. Which one should you choose? This is different for every single practice, and there's no right or wrong answer at all. The best thing to do before choosing which practice management software to use is just to take advantage of a free trial, which most of them do offer. Most of them offer a free trial and you don't need to put in your card details. I know certainly WriteUpp do this. You can have a 30-day free trial and you don't need to put in any card details. So when it comes to the end, it's not going to charge you and it's not going to roll on. Your data will just be deleted and that'll be the end of it. These are the best ones to go with. If you're setting up tons of trials, you don't want to also have to keep an eye on when they're going to run out and if something's going to charge you. So do take advantage of the free trials without a credit card required when you sign up. Another thing to bear in mind is that you don't have to import all of your patient information into every system you try. You just set up a dummy client or two, maybe set up yourself and a friend or a family member or somebody else, or just, what we do is set up John Appleseed. He's just a guy, he's nobody, and put in your own email address, your own phone number in there, and just work through your own workflow and see if it works for you with you and a dummy client and see how it goes. You don't need to put everything in there and do the whole lot for every system or software that you try out. Just do the bare minimum just to make sure that you get a really good idea about it. And then whilst you're on your trial, just make sure you can tick off maybe not all of these, but tick off most of the key factors. Just make sure that it boosts efficiency and it saves you time. So a month's trial, if you really go for it, should help you to figure this out. It makes sure it automates tasks and streamlines your workflow for you. It needs to enhance your client's experience as well as yours. So you want to make sure that is your investment is worth it for your clients as well as you. Make sure it has a stable and reliable invoicing platform. Invoicing is one of the admin bugbears and it can take up so much time. So it would make sure that your invoices can be done quickly and efficiently and with least time spent on them as possible. And also make sure it's a scalable solution. You might take a trial out and think, I don't actually need all this stuff right now. But maybe in the future you will. Maybe in a year or so you will want to go and explore more features. And and more things that you can use in your practice. For example, you might start using practice management software, but you don't want people to book in online. You might just want them, you might want them to still book with you. That's fine, but it might be, you know, just make sure that there's got things that you might be interested in using in the future. So that's kind of brought us to the end. I'm going to have a look in the Q&A box. I know Emma and Leanne have been really busy in there, but I'm going to have a look and see if there's anything I can answer at the end. But before I do that, if you do want to know more, you can take a free trial at WriteUpp. So just head to writeup.com/sign up. You don't need to put in any card details. All you need to do is sign up there. There's a little tutorial video in there that will show you how to get started, also a tour as well, and you can have a click round and see what it looks like and what it does. So you can do that. You can join one of our more in-depth webinars. We've got loads of recordings of our previous webinars, which we go through basically the WriteUpp. There's one that goes on for an hour, which is WriteUpp from start to finish. There's some really, really good ones in there that you can check out and grab a cup of tea and sit through and have a look and see what it does before you actually sign up, if that's what you prefer. You can grab us for a live chat. Come and speak to us. We're really, really friendly and we love chatting. We absolutely love it. So if you do head to writeup.com, just in the bottom right hand corner, there's a little live chat button. We are more than happy to talk you through any of the stuff. You don't have to be talking about WriteUpp. You can talk to us about anything that you've just heard about in this webinar. We're happy to do that. And also watch our videos on YouTube. We've got a whole library of videos on YouTube that you can look at. And you can explore. So there's loads of stuff in there. So hopefully that is helpful. Okay, so there's a couple of questions in here, and one of them is, what about security, rogue people booking? You're in control of who books into your diary. So you'll be given a link. Basically, your online booking is a. I'm going to actually, do you know what I'm going to do? I'm going to show this to you instead. I'll show you what the online booking kind of looks like so you can see. Again, this is going to be similar in most practice management software. This isn't just WriteUpp. So, but if you just bear with me, I'll pop this in here. Right. So, if you were to use WriteUpp, you will have your own booking URL. Which basically means it's yours, it's only yours, and you will decide who gets that link. So it would be very difficult for somebody to randomly find this link and book in. So you would put it on your socials, you can put it on in email, and you can send it to whoever you want to send it to, essentially. So that's one part of it in there. The other thing is you would have to have they need to give their details. They need to give their email, their phone number, and their name in there as well, so you will know who's booking in. But if you don't want anybody, if you really, really don't want anybody to be booking in to your diary who you haven't first screened, then I would probably suggest not using online booking. It's there really to make it easier for you. If you do have it on your website, then obviously anybody could find the link, they could book in, but that's kind of what it's there for. So if you did want to have people booking in to a new appointment with you, they could do that. If you really did want to screen them first, or if you could have something set up in there that would be like a screening or a triage appointment, they could book into that. That would just be a little bit of setup for you. But basically, this is what it looks like. They will fall onto your page here. They can see your availability, and then they can go through and they can book in. They'll find a slot in here. They click book. They put their details in and they confirm it, and then that will just be automatically added to your calendar, and it will be you'll be notified of that booking. So yeah, I kind of hope that answers your question. They will be able to book in if that link is available to them. Okay, so I think actually Emma and Leanne have done a stellar job answering all these questions, which is fantastic. If you do have any more questions, if I pop into WriteUpp, you can see this is the little live chat button down here. Just go into there. You can grab us for a chat at any time. We're there Monday to Friday, 9 to 5. If at any time we are not there, we're not available, just send us a message anyway. We'll get back to you the next day by email. We are all more than happy to do that. And as I said, if you did want to book on any webinars, you could head to our website, and you can see there's a little button underneath the Start Your Free Trial button that says take a look at our webinars. Please do go into there and you can have a look and browse through those as well. So I really hope this was useful. A recording will be on its way to you so that you can look at this. I'll also send the slides out as well. Oh, no, it's fine. I'll also send the slides out as well to you. And again, if you've got any questions, just let us know. You can just reply to that email, or you can grab us for a live chat. And we really, really do hope to speak to you soon. And we do hope really to see you on WriteUpp as well. It'll be fantastic to see anybody there. Anyway, I hope you have a lovely day, a lovely afternoon. You can all go and grab some nice lunch now, and we'll speak to you soon. See you later, everybody. Bye.